Welcome, everyone. I'm Steve Adubato. We kick off this program talking about nursing in 2022 and beyond. We're joined once again by Michele Acito, Executive Vice President and Chief Nursing Officer at Holy Name. Good to see you, Michele.
Good to see you, Steve.
Do this for us. I asked you right before we got on the air. We're taping in February 2022, see a little bit after that. You can't predict the future, but you can tell us what you're seeing right now. What are you seeing?
That's right, Steve. You cannot predict the future. We've learned that over the last 2 years better than ever before. What we're seeing today are single digits of patients in the hospital, 0 patients on ventilators, 0 patients waiting in the emergency room with COVID. A very different picture than over the holidays when we had nearly 100 patients in-house and between 15 and 20 on ventilators and 20 to 30 waiting in the emergency room. We're in a much better place than we were just few weeks ago, and we're looking forward to a future with the same progress.
Michele, last time you joined us, we talked about nursing at that time, nurses at that time. What do you believe the longer-term impact of COVID will be on the nursing profession?
You know, I think the impact is going to have a lot of effect on what people remember, how bad it was during 2020, and then the 2 waves that followed it. But I also think it's going to have a positive impact on our profession. People learned early on that we could make a difference, that we were there to provide the care, to be the stand-in family member, and knowing how you can make a difference to your own community and to your own peers really makes a difference. Immediately after the first wave in 2020, we saw a significant increase in our number of students enrolled into our school, 100% increase in applications, and that made us feel real good. While we wait for these student nurses to graduate, we do struggle. We struggle with the people who have retired, the people who thought they could work a few more years, but realized during the pandemic, this may have been too much for them at the end of their career. So while right now we struggle with staffing, we struggle with burnout, we do look forward to the future when these nurses graduate and can join the ranks.
You know, Michele, we've talked also about this before. I do a lot of leadership development in my other life, and I talk to a lot of nurses and physicians, and Holy Name is in fact one of our underwriters at the Caucus Educational Corporation. But this is the issue that I want you to talk as candidly as you can about, and it's burnout. I've been struck in my leadership coaching about how many physicians and nurses who are close to tapping out, that they just can't take it anymore. And so my question is this: in terms of taking care of, it's one thing everyone was celebrating, you're our heroes. That was then. That has stopped. Forget about physicians for a minute, nurses, how are they maintaining their well-being?
You know, it really isn't easy with the inability to celebrate together, to gather, to allow us to have that time to decompress. You know, doing it via Zoom has helped, and we did a lot of that after the first wave. People talked about it, talked it out. But when you can't gather and you can't celebrate and you're always concerned, am I going to catch the disease? Am I going to bring the disease home to my children under the age of 5 who can't get vaccinated yet? Am I going to bring it home to my elderly parents? Am I going to be the one who spreads it in the house? It is a lot, and the burnout is very heavy. You know, in addition to not gathering, people weren't able to take vacations and decompress with their family and let loose and have a good time. So until we can reach that point, this burnout is going to weigh heavy. And not only the burnout of not being able to gather, but having seen what we saw, it was a lot. It was a lot to handle. It was a lot on our minds. And then the added pressure of not having visitors. We wanted visitors more than anybody, but we knew that wasn't safe. So when you're not only the caregiver, but now you're the family member, that added burden of the FaceTime and the sad goodbyes and the sad family gatherings, perhaps for the last time, those are things that you don't forget. Those are images that you bring with you every day when you come to work. And the burnout is difficult. We try very hard to talk to staff, to work with staff, to make sure that they have everything that they need. But at the end of the day, these are scars that will last for a long time.
You know, Michele, as people watch NJ Spotlight News every night, or Metro Focus on the other side of the river, but covering the region, but particularly on NJ Spotlight News, there have been a whole range of stories with nurses and nursing leaders, let's say, in your profession, who have spoken out against vaccine mandates for healthcare professionals. What is the level of resistance at this point that you can sense in your organization and in the profession across the board of nursing to the vaccines?
You know, at Holy Name, we did not fire people who did not get the vaccine. You know, we made sure that they still wore the proper PPE, as everyone does. They had weekly testing, and we talked to them. We helped them to understand the things that they may have been misinformed about. And that route really helped us. What it did was it gave them a sense of trust that we weren't just going to fire an unvaccinated person, because that didn't help anybody. That put an unvaccinated person on the street in the community without a job. Our approach really helped a lot of people understand the need for the vaccine. And we saw a lot of people turn the corner and get vaccinated and then get boosted. And I really think that having those conversations and not taking a hard line on the other side is what brought Holy Name to a very high vaccination rate.
But hold on, Michele, there are a whole range of other healthcare organizations, individual hospitals and groups of hospitals, networks, if you will, who did mandate it. University Hospital being one of the first, with the former commissioner of health, Dr. Elnahal, who is their CEO right now. They mandated it. I'm not going to get into who was wrong and who was right, but you're saying there's more than one approach to this vaccine resistance, as opposed to mandating it, which has been the case with a lot of healthcare organizations, a lot of hospitals.
Mm-hmm. Mandating it, you know, I was glad that the mandate came into place because it really had us open the conversation with employees who may have been misinformed. When people are misinformed and then they're fired, they're still misinformed, they're still unvaccinated, they're still in the community. But having the opportunity for an infectious disease doctor to work with these employees and help them understand the benefits and how they could help themselves and their family really worked. We saw a large turnaround for the number of employees that were unvaccinated.
But Michele, help me understand. I have something wrong in my mind here. There is a government mandate that everyone who works in a hospital be vaccinated, but there's not one at your hospital.
There is. And for the people who did not get vaccinated, they went through the proper channels for either a medical or a religious exemption. But we wanted to make sure even those employees understood that if that was, you know, their belief, we respected it and we did not make them get vaccinated. But for the other employees before the mandate who did not want to get vaccinated, we wanted to make sure we worked with all of them to ensure that they got vaccinated. For the people who are unvaccinated now, they have a medical or a religious exemption.
Before I let you go, this pandemic has affected all of us in one way or another, but you're much closer to it than those of us in broadcasting. 30 seconds or less, how has this pandemic impacted not just you as a person, but you as a nursing leader?
It really has impacted the way I appreciate life every single day and every single nurse, and that the work that they put in, the work and how much effort they've put in to come to work every day and not say, I can't do it, I didn't sign up for this, because we did sign up for this and they rose to the occasion. And the appreciation I have for every one of them, it cannot even be measured. They're all heroes to me.
Well said, Michele. And for those who think that time passed in 2020, 2021, to say our nurses are our heroes and physicians, that time will never get old. It's never inappropriate. Thank you to you and all of the nurses who are making an extraordinary difference every day. Thank you very much, Michele. We appreciate it.
Thank you, Steve. Have a great day.
You got it. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by New Jersey Institute of Technology, Valley Bank, Johnson & Johnson, the Robert Wood Johnson Foundation, PSC&G, the Healthcare Foundation of New Jersey, New Jersey Sharing Network, the Russell Berry Foundation, and by Delta Dental of New Jersey. Promotional support provided by NJ.com and by bestofNJ.com.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org and be sure to talk with your family and friends about this life-saving decision.